In the committee for the health, hospitals, and social services, and we have enough for a quorum. So the first bill is RS 2019-1761, resolutions Vercher and Gilmore. It approves Amendment 1 to a grant from the Greater Nashville Regional Council to the Metro Social Services Commission to provide nutrition, home, and community-based services to eligible seniors throughout Davidson County. May I have a motion? It's been moved and it's been properly seconded. All right. Is
this is the same thing that we do every year?
Yeah.
Yes, but just, if you don't mind, Madam Chair.
no, that's all. I want you to
Thank
speak.
you so much. This is $80,000 additional grant that we requested to provide our seniors with breakfast meal. Although right now they're receiving 5-pack meals. So we surveyed them back in the second quarter of this past year. It was like 200-something homebound seniors, and about 85% of them said they wanted breakfast meals because we know hunger is existence, and most of them spend their money on medicine. So we petitioned GNRC if there was funds, if we can provide some breakfast meals and also weekend meals. So now, with the approval, getting the $80,000 additional through the end of this fiscal year, it would help us to provide breakfast meals for them, nutritional, hot meals, frozen meals. So yes.
Weekend meals, right?
Yes, weekend meals.
Oh, that's
yes,
nice too. That's really awesome.
Yes.
And you said it's about 200 or so?
About 231.
Okay. And how do you get the persons to know? How do they know that they qualify for?
Well, they already eligible receiving the meals now. They're already receiving 5-pack meals. So what we look at is the neediest of the neediest. This meaning that the person doesn't have any support where a family member is coming over preparing foods for them. So that's like a priority to say they don't have any means of support, are unable to get up and cook for themselves. So with the meals being where they just put them in the refrigerator, for that meal, and then put them into the microwave, they have the meals when they need it.
Yes.
Yes.
Yeah.
Oh, I love it. Any more questions from the committee? Any more questions?
Nope.
All right. Seeing no more questions, we're ready to vote. All in favor?
Aye.
Seeing no votes and none against, it is recommended to the full body for approval.
That's
Thank
good
you.
stuff.
Thank you.
Thank you.
No, thank you. We appreciate you.
And I look forward to voting on your issues every year because I remember seeing those programs in the community that I lived in.
Yes,
and
thank you.
also even though my grandma was not one that used those services, but there are people that are out here that we all know.
Thank you.
Thank you all.
And I do have a testimony for one,
Sure.
if I don't mind reading
Yeah, go ahead
it.
and share.
Yes, and I loved it. It just came into my office just recently, like last month. And it did touch my heart. This was from one of the volunteers that actually helped at the site. And it was a thank you card. And she just said, this was May 13, 2019. Dear friends, it is my belief in life, things are placed for a reason and a purpose. I have discovered in volunteering, this is to be true. Self-work and usefulness are restored or either destroyed by retirement. She said, motivation to serve and avoid becoming a wasteful, willing, or precious time. Socializing with various backgrounds, cultures, and nationalities while sharing personal experiences. Laughing and crying creates a lasting friendship and memories. May I thank you for giving me the opportunity to volunteer and be involved in your program. Gratefully, Faye Fishborn. She is one of our volunteers that's been just recently last year, and with us asking her to volunteer at one of the sites where she lives. She said this provided her a means of getting out, self-work, being able to socialize with all types of culture. This touched my heart to see that it's really working for people. So yes, and my passion is to make sure our seniors and disabled continues to be fed nutritionally.
That
So
is so
thank
important.
you all. I
No,
appreciate
thank
it.
you. We appreciate you. That is so important. Thank
Thank you.
Thank you. So our next one is Resolution 2019-1762, sponsors Vercher and Gilmore. It approves the letter of agreement by and between the Tennessee Breast and Cervical Screening Program and the Metro Board of Health for reimbursement of cervical cancer screenings. May I have a motion?
So moved.
Okay, been moved and properly seconded. Is there any discussion? So I think, yeah, this would be Tom. He's not here today.
Stuck in traffic.
Yeah, he's stuck in traffic. It happens. Okay, we'll maybe come back to it then. Do y'all want to come back to it, or you're just going to?
I think we can go ahead. I mean,
Okay.
we all for breast.
Definitely. I didn't know we wanted to hear something.
Necessary.
Yes, we're definitely for it. I didn't know if we wanted to hear some good information about it, right? Okay, so we'll go ahead and take a vote, all four. I know no one's against. It'll be recommended for the full body for approval, seeing that none were against it and none not voted. All right, appreciate you, committee. The next one is Resolution 2019-1763, sponsors Virtue and Gilmore. It accepts a grant from the Tennessee Department of Human Services to the Metro Board of Health to conduct immunization record audits for child care centers, drop-in centers, and group child care homes to ensure the safety and well-being of children and families in Davidson County. May I have a motion?
Second.
Moved and properly seconded. He's not here. We were going to go ahead and vote once again
Yes, we
before
should.
immunization.
Immunizations are necessary.
Yeah, definitely.
Absolutely.
Period runs to July 1 through September 30th, 2019.
Wonderful.
It's not to exceed $14,705, and you stated in the preamble what it was for.
Yes. All right. Thank you. I appreciate you, Vice
Yes,
Chair.
yes.
Couldn't have a better side pocket there. Thank you so much. All right. So we're ready to take a vote? All right. Seeing none against and none not voting, is recommended to the full body for approval. All right, the next one is Resolution 2019-1764, sponsors Virtue and Gilmore, accepts a grant from the Friends of Metro Animal Care and Control to the Metro Board of Health to provide additional free microchips for animals that are adopted at the shelter. May I have a motion?
So moved.
It's been moved and properly seconded.
$260 is what the grant sheet tells us on
That's
this.
all?
Just for free microchips, so.
Must be the actual chip itself, because that would be a lot of microchips. And it's just a procedure to put it in, so
Okay.
it's an injection.
Yeah, I think my doggy has one. I think it's like, yeah, underneath
Hey,
this.
you need to check. So you can find it.
I think they put it like underneath there somewhere. Here we go. Boy, you so funny. All right. With that discussion and seeing that we got a lot of chips, it's a simple injection. How many for? Seeing none against. All right. It is recommended to the full body for approval. You guys are rock stars. We're just getting it done. We even have someone to explain it from the committee. Oh, there it
I was
is.
doing my best Tom Sharp imitation, but it wasn't working.
That's all right.
Excellent.
You know, we do have a presentation, so.
Yeah, we're moving it along. Thank you, madam. All right, she's got us squared away. Okay, here we go. Resolution 2019-1765, sponsors Virtue and Gilmore, approves Amendment 6 to a grant from the United States Environmental Protection Agency to the Metro Board of Health for the ongoing collection of data on ambient air concentrations of 2.5 fine particulate matter in Nashville, Tennessee. May I have a motion?
Motion, second move.
Okay, it's been moved and properly seconded.
That's what it says it is. That's
right.
ongoing. Think of this particulate stuff, little bitty stuff that can get in your lungs, and they get paid
Yeah.
when they shake out the seat cushions and find some more money.
Yeah.
They send it to us.
Good deal.
Good
Now, is it a little mark? For some reason, I thought we had something around the city too that was movable. Is that something else that I'm getting
Yeah,
mixed?
that's something.
These are
Okay.
fixed.
Okay. All right then. Well, thank you. We're gonna let you catch your breath. Thank you for being here. We appreciate you.
So get some particles there.
So, if there's not any more discussion, all in favor? All right. Seeing none against, none not voting, is recommended to the full body for approval. All right. How we doing over there, madam? Council member? We working, making it through.
We need to get it going.
We're still not moving fast enough. Resolution 2019-7066, sponsors Gilmore, approves Amendment 1 to grant contract from the Tennessee Department of Health to the Metro Board of Health to improve the health of those residing in or visiting Davidson County through targeted strategies to prevent and control the use of tobacco products. May I have a motion? Moved and properly seconded.
So a few years ago, the state got a windfall from the master tobacco settlement. It sort of dropped in their lap. It was $74 million. $24 million of it was used to build a boiler at the University of Tennessee. Haslam was governor
I
then.
remember that.
And then most of the rest of it went away. They had $15 million that they programmed over 3 years. That eventually ran out. They got $2 million requested for those programs for next year. They didn't get it until right at the end of the legislative session. So they called all the contractees and said, we need a contract in place. We'll tell you how much money it is when we figure it out. So we'll get one, that's a no cost, and you'll get one that has money attached to it, hopefully soon.
All right.
All right, sounds good. Any more discussion, any more questions? Seeing none, we're ready to take a vote. All right, all in favor, seeing none against, none not voting, is recommended to the full body for approval. All right, so we have a full committee. That is awesome. Resolution 2019-1767 sponsors Gilmore approves Amendment 2 of the grant from the Greater Nashville Regional Council to the Metro Social Service Commission to provide meals that meet RDA nutritional guidelines and transportation services to eligible seniors and handicapped residents. Yes, ma'am. Oh, let me get a motion. Moved and properly seconded. There we go. Yes, ma'am.
That was, same provisions. That was for the transportation piece. Also, that is included for those that's going to the congregate meal site. So we have the homebound meals and the congregate meals. So that's for the congregate.
Do you know who provides the transportation service?
Yes, MTA.
Okay, so MTA does. And is it contracted out or is it just MTA itself?
It's just MTA themselves. They do it through the SS Ride.
Okay.
And I think the provision is like $70,000 that is provided for them to do the services for those that want to get to congregate sites.
Okay, thank you. Any more discussions or questions? All right. Seeing, okay, no more discussion. All in favor? All right. None voting against is recommended to the full body for approval. All right. Good over there? We good?
Yes, sir, ma'am.
That's right. That's okay. Resolution 2019-1768 sponsors Virtue, Syracuse, and Gilmore. Accepts a grant from the Nashville Public Library to the Nashville Public Library to partially fund a project coordinator position for the NASA Youth Level Outcomes Framework Research Initiative. May I have a motion?
So moved.
Moved and properly seconded. There's no one to give. Are you here to discuss that, Miss Frida? No? Which one? The one about the NASA for the framework initiative for the libraries? I didn't put something to
It's
me.
interesting to find out why it was sent to health.
Yeah, definitely.
Must be
I
some
wonder if
health
it was
screening.
mistaken.
I don't know if they're considering the youth level
I know.
outcomes for health.
I know when I was over District 1 and they had something at Whites Creek, there were community fairs that included health services and, where you're taking blood pressure and those
Yeah.
kinds of things. So that might be the reason why.
Okay, so I guess the question is, does the body feel comfortable moving on it? Do you have further questions? You want to see why it came to our committee? Are we good just supporting it?
Oh, I think it's a good thing. I mean, the NASA program is definitely good.
Yeah.
It's always a full house, and the kids seem to enjoy it. And I think anything that we do to try to help support them is a good thing.
Well, let's move.
April 1 through October 1 of 2020.
Okay.
Not to exceed $28,600, no local match.
All right, that's not a lot of money. So we'll see what they can do with it.
But it's a part-time, I think, a partially funded position.
Okay, so we're ready. All in favor?
Aye.
Seeing none against is recommended to the full body for approval. And then we have our last one. It says, let's see, later, to defer with budget. Okay.
For one meeting budget, remember?
Okay, yes. So I'll go ahead and read it, just so everybody can know what it is, and we're going to defer it to track with the budget, just so you know. But it's Resolution 2019-72. It adopts a new pay plan for employees of the Metro Board of Health effective July 1, 2019. So we move to defer so they can track with the budget.
Yes.
Move for deferral.
Second.
All right, so that's done. Any against that? Nope.
All in favor.
All in favor is recommended for approval. So this part concludes our resolutions for the committee. It's my understanding that we do have Dr. Hildreth with us, the illustrious president of the wonderful Meharry Medical College. We are so delighted to have you here. And would you please introduce, you have some wonderful people with you as well. If you could introduce those wonderful people, I'll let you do that.
Madam Chair, thank you so much for the opportunity to come and speak to you about something that I'm really excited about, super excited about, as a matter of fact. So to have the opportunity to talk to you about it, I really do appreciate it. I have with me here Dr. Dexter Samuels, who is the director of our Health Policy Center, and we have Dr. Veronica Mallett, who's our Senior Vice President for Health Affairs and Dean of the School of Medicine. And they were both instrumental in getting this work done, and so I'm happy to have them here to correct me if I get something wrong.
Okay.
Now, I'm a professor. You know, when we talk, we need to make sure that people are following along. So I have some handouts here, if that's all right. I promise you I won't go through it word by word. I don't have enough for everybody here, but since my colleague from hospital is here, I think I have one more. If you'd like to. Okay. So we can just go to the first page. This is where we're going to start.
Okay.
So on November the 7th, 2017, the former mayor of the city made an announcement that she thought it was time to close the hospital. And of course, that was a catastrophic thing for us. We lost 30 hospital-based physicians, patients stopped coming. It cost Harry millions of dollars. And so I took it upon myself to ask her if she would allow me to put together a stakeholder group to propose a plan for indigent care for the city, much larger than the hospital itself. If you can turn to the next page, the reason for me wanting to do this is that we now understand that your health is more than just health care. As a matter of fact, most of the factors that contribute to our health are individual behaviors and social and environmental factors. If you add those two up together, that accounts for 60% of our health and our wellness. So I view it as an opportunity to revisit how we take care of people, knowing that these two things are so important. So very quickly on the next page, you can see that this is from the Kaiser Family Foundation. It tells you what those social determinants are: economic stability, whether or not we have a job, medical bills, etc. Our physical environment. We now know that your zip code can sometimes have more to do with your health than who you are or what you are. Your education, literacy contributes significantly to health and wellness. Access to nutritious food is another thing. In other words, it's more than just having access to hospitals and hospital care that makes for a healthy community. And I just felt that given Nashville's tremendous ecosystem, we could come up with something that would take better care of the folks that we care about. On the next page, it breaks it down into the three root causes of health care disparities. And the Kaiser family calls this the 3 A's model of structural barriers. Awareness. People don't know about the healthcare system and how to use it. Access, they can't get to it. And the third one is affordability. When they can get to it, they can't afford it. So these are the three things that would create a structural barrier to people getting the good healthcare. So the next page gives you the status of our current system of indigent care in Nashville. First of all, it's reactive and based on inpatient, not proactive in keeping people well, which is really important. There's been a lack of investments in our capital structures for taking care of folks in the city. That's been true for a long time. The decision not to expand Medicaid left 300,000 folks, including many in Nashville, without any access to health care or health insurance. There is a safety net consortium in Middle Tennessee, and it has had the most coordinated effort to take care of folks who are underserved, but even that is not proven adequate because of the resources available to them. And then finally, everyone needs to understand that as a percentage of the care that's delivered, NGH by far has the greatest proportion of this care delivered to folks who are not insured, who cannot pay. And if you look at the next thing, it shows you a map of where the folks in poverty live. And it just so happens that Meharry and NGH are right in smack in the middle of where most of these folks are. And so we feel obligated, and it's part of our mission, to do something about and deliver the best care to these individuals, because we are right in the middle of where most of these folks are. Okay. Next page. So there are over 100,000 people in Nashville who are either uninsured or underinsured. And what do I mean by that? There are a lot of people with insurance, but they don't use it because the copays are so high. As a matter of fact, there was a study done by Aetna where they noticed that the African Americans who had a heart attack who were insured did much more poorly than white individuals who had heart attacks who were insured. What they discovered was the copays for the medicines were so high that the folks with the worst insurance plans did not get the medicines, and therefore did really poorly. They decided to drop the copays for those medicines. It's a major decision for an insurance company to make. What they discovered was that leveled out the outcomes for the two, because now the black folks got their medicines because the copays were no longer required. And that's just a simple example of how small things can make a huge difference in how people are cared for. And according to the Tennessee Hospital Association, the three major hospital systems that we affectionately refer to as the Big Three, Vanderbilt, HCA, and St. Thomas, in 2017, they delivered more than $150 million worth of uncompensated care. Now, one of those hospital systems will say, well, that's wrong, Mr. President, because we delivered that much on our own. So this should actually read, at least $150 million of charity care was provided by those organizations. And this last bullet point is really important. 109,000 individual patients and 300,000 plus visits were seen in 2016. And quite a large fraction of those went to the emergency department. And as all of you know, the emergency department is much more expensive to care for folks than when they go to an outpatient setting. Okay. Limit for time. But the next slide shows you, and this is really important, look at the very top and the very bottom. This shows you as a percent of the care delivered, how much of it is charity care or uncompensated care. For Vanderbilt and St. Thomas, it's a rounding error of their total revenue. But for Nashville General Hospital, over 50% of the care that's delivered is actually uncompensated care, which is the definition of what a safety net hospital is supposed to do. But this is highly significant that this one hospital is caring for a disproportionate share of charity patients versus all the other hospitals in the city. Okay. So next, if you don't mind me pontificating about my two organizations, Meharry and NGH, I believe that together, Meharry and NGH represent a pearl in the city of Nashville, because we have been doing this for a really long time. Our whole mission is to make sure that people without opportunities for care have a place to go to be taken care of. We take pride in that. We also take pride in the fact that 70% of our graduates choose primary care, but more importantly, 80% of our graduates serve the underserved. And that's been true for a really long time. So this is part of our DNA, and it's why I was really happy that the mayor gave me a chance to lead this conversation. So just to establish that we believe we have some standing to be a part of the solution. That's all that I want to make of this. So the charge I gave to the stakeholder group back in December of 2017 was come up with a systems approach for healthcare that leaves no one behind. That was the charge they were given. And I think they did a great job of coming up with that. Just the next page shows you that all the major stakeholders in the cities were represented. And I don't want you to read that list, but if you turn to the next page, you can see Nashville General Hospital was represented, Meharry was represented, the mayor's office was represented, council was represented, Vanderbilt, HCA, St. Thomas were represented, the health department, the safety consortium, IMF, and there's lots of others who were part of it. So in other words, this is a very inclusive stakeholder group that worked for 14 months to come up with this plan. Okay? And here are the priorities that they laid out for themselves: dedicated funding source, integration of the system, incentives for collaboration, that there be a fair share of revenue among the people participating, that there be no disproportionate burden of patients who could not pay on one group versus the other. This is very important to take a population health approach, because again, medicine for too long has been focused on reacting and fixing people. We now know that it's better to be proactive and keep people healthy. That's what we mean by population health approach. And then finally, I just want to say we had these models and components of the plan that they worked on. And if you can just get you to turn to a couple of pages here. I'm sorry. Can we just skip to this page? It says, a systems approach, enhancing the patient experience. So here's the meat of it. These are the elements that we think are necessary for a comprehensive plan. First of all, there needs to be increased access to subspecialty care. that there needs to be an integrated behavioral health component to this, because for too long, behavioral health has not been a major component and emphasis. We think that it has to be. We think there needs to be community-wide health education, which gets to that awareness thing that I spoke about early on. And this is really important as well. We need to send patients to the most appropriate site for service. Because when you take care of people in the wrong setting, the outcomes are not good and the cost is higher than it needs to be. That's what that means, right? And then we need to have community health navigators who will make sure that people are compliant with their treatment plans, right? If people get a prescription from the doctor but don't take the medicines, the outcomes are not going to be good. So social workers and case navigators can make sure that people are compliant with their treatment plans. That means better outcomes and lower costs. And if I can get you to skip now once again to this page. Sorry, they're not numbered. This is a really, really critical piece of this whole thing. Okay? What we have here is, this is the page. We have the three major components of the system: Meharry and NGH, the federally qualified health centers, and Meharry and NGH as a partner is in the center. We're the hub of all this. Then we have the big three that we call Vanderbilt, St. Thomas, and ACA. What this plan calls for is what I just said before. Patients come to the clinics for their primary care. They're referred to the hospital for inpatient care. We're going to select the service lines that make the most sense, that can be delivered at the lowest cost. And for example, transplant surgery is not something that should happen at NGH. Vanderbilt has been doing transplants for many, many years. It's something they do hundreds of, thousands of a year. They've got the cost down, the outcomes are great. We should be referring transplants to them, or spine surgeries, right? And that's what that means. The high-cost subspecialty inpatient care should be referred out. In return, this is what I'm really excited about. They have agreed in principle, the CEOs of these big three, that they would transfer low acuity patients to the hospital, which would keep the census up. And the reason why hospitals are closing is if your patient census is not sufficient to meet the fixed costs, you cannot survive. So having the big three willing to do this means that we'd have a financial model that'd be much more likely to be successful. And this is a really big deal. And as far as I know, this kind of conversation had never happened before. And why would they do this? You might think, it's not because they're good. They are good-hearted people, don't get me wrong. But if they can free up some of the low acuity beds to do the things that they make a lot of money on, it's in their self-interest to do this. And that's one of the beauties of this. We're not asking people to do more or anything different. We're just leveraging the strengths of the individual organizations. And to me, that's a beautiful thing. That's what collaboration and partnerships are all about. But this is a key part of the whole plan, this partnership, this collaboration of making sure we're leveraging the strengths of the vast ecosystem here in Nashville. And that's why I'm so excited, because it means we're going to have a workable model that leverages the strengths of everybody. And not shown on this are the navigators, the case managers, and all the other folks that will help us manage the social determinants. That's on this side. Okay. So, if I can just get you, I'm sorry, I'm going fast. This next page summarizes why this is so exciting. It is healthcare for the indigent in Nashville reimagined. To be broadened, to address the medical and social determinants of health, to be convenient, so that people have access to it when they need to have access to it, personalized as distinguished from precision medicine. I'm a basic scientist, and I love the idea of precision medicine where we use genomics, proteomics, and all of that. But the truth is, if we get good old-fashioned medicine to the people who need it, that would have a much better impact on health in the United States than precision medicine ever would. And that's what this means, personalized, to get the care that people need to them when they need it. And lastly, integrated. Integration will lead to lower costs and better outcomes. And so this is what the Better Health Nashville plan does. Broadens the care, makes it more convenient, personalizes it, and integrates the vast ecosystem in Nashville. If there's one city in which this could be done, this is it. because there's so many resources for healthcare in Nashville. We just got to get them to align and partner, and that's what this plan does. And that's why I'm so excited, because the resources here are just tremendous. They've just never been aligned in partnership, and that's what this plan does. Madam Chair, thank you so much for letting me.
No, thank you. It was so engaging. It was very engaging and informative. You are wonderful. I just was hanging off you every word. It was very engaging. I really mean that. Does anyone have questions? I have more questions.
I
just want to observe. So,
Yeah, I do.
Councilmember
Yeah.
Hastings, and then Weiner, and then Pulley.
Yeah, I want to thank you very much for doing what you do. Of course, we've talked on several occasions.
Yes.
One of the things that I am overall with this plan, it is so identical to the plan that's already in place from Dr. Webb at the hospital. And I know that there's collaborations that's been going on, but I know that a lot of this is separate. And we don't need two separate systems. With the collaboration, I know that they are already working on, which I know because my mom was a part of that system, which she didn't necessarily take care of herself in that they had a social worker who went around and called and checked, and that was more of an example of what you were saying. So that works great.
Yes.
That works great. And I think the follow-up on that is wonderful. The overall thing is just being able to have the overall providers who are going to be there to take care of those things, and that's where the collaboration with some of the other hospitals are so vitally important. Because during the time when my mother, when she passed, I know that there was a cycle to where we did not have a doctor that was dealing with that sort of cancer that was in-house during that period of time. And I know there's contracts on two sides. There's one side that's going on with you guys who providing the physicians, and then there's Metro's general side. I think that these two plans are this. I don't think the overall plan that you have. I think it's just right, but I don't know how different it is from the actual plan that they have and that they're trying to implement right now.
We're not proposing a plan that's separate and apart, because part of this plan is that Meharry and NGH are still partners.
Okay.
The way the academic affiliations work is that hospitals do what hospitals do, which is support the providers, because only providers can put people in hospital beds, right? And normally what happens is the provider group is charged with doing that, and the hospital is charged with supporting those providers who provide those services. So I'm not proposing anything other than that the partnership between Meharry and NGH will be much stronger, because now we got the big three referring patients to us. But that partnership is still there. So I'm not proposing that there not be a partnership.
So in the big three, which because I was a part of the conversation prior to, because of the plight of trying to shut down the inpatient route, I know that there was already a connection with Vanderbilt and some others to feed into the current hospital to already start a sector. And it may not be called the big three sector, but I'm not dissing this here. I'm just saying that, okay, we have two different models that are here that are somewhat of the same, and we need to clarify and make sense of this to know that we are all on the same.
I don't quite understand what you mean by two different models, because again, what I'm proposing leverages the strengths that we have already, but also then leverages the strengths of all the vast ecosystem here in Nashville, and that's never happened before.
What I'm saying to you, Doctor, is that right now, I know this part because I worked really, really hard to communicate with them, and I was fussing with them on some of the things, and that's what Dr. Webb and all of that, and I don't know all of the inside stuff. I know that there was a plan such as this that was given to me about that. I think we need to, because I know Mayor Berry had a call for a separate group, but I think we all need to come on a oneness to see what's going on. instead of
I
two
think the
different
plan you're
plans.
talking about, Councilman Hastings,
Yeah.
was a plan for Nashville General Hospital and what they
Yes.
were doing.
Yeah.
That's basically encompassed in what's being asked here. And the outside, those big three that they're talking about, will work along with the Nashville General Hospital with what they already have.
And the way I see it, and correct me if I'm wrong,
Yeah.
this is more of an alliance between
Yes.
all of the, or among all of the hospitals, but especially between
Yes.
Nashville General
And the
and
FQHCs.
Right.
And that's not happened before.
Yeah, and if they are already, Mark, you're here. Isn't there a system that they're working out of right now with those big three? Am I not understanding this correctly?
We've
Can you
obviously
help
been
me?
working with Meharry on our patient-centered medical home,
Yeah.
and as Dr. Hildreth mentioned, the next penetration really needs to be behavioral health,
Yes.
right? Because if you have a patient who comes to the ER who has a mental illness, you can give them all the meds in the world, and they're not going to be able to sort of take care of themselves. So
Yeah.
that's sort of the next venture.
Okay.
So there's a plan for the hospital, but this is a plan for a system. Those are two different things.
For the system. So this is providing to put Meharry into the system that would be able
It's
to continue.
putting Meharry and NGH as a partner, as
Okay.
a hub of a system.
Yeah.
There's no plan to separate us,
Okay.
because our fates are linked, and that's not going to change.
Yeah, that's what I'm trying to see, because it's confusing to me. That's what I'm trying to, because it's somewhat of the same. I'm hearing some parts over here and over here.
Hospitals are part of a continuum of care.
Yeah.
There's a plan to make the hospital successful, but that's only a part of a continuum of care. There's ambulatory settings to take care of low acuity events, and then we need some so what I'm saying is that the hospital needs a plan to make it successful, but that's only part of a continuum of care, and that's what this plan is. It addresses the whole continuum of care. Okay.
We have 9
Thank you.
minutes left, so.
Mine's going to be really quick because I have questions about capital costs that are going to be required over time, the amount of time you have the phased approach, the
Yes.
role of the VA, the Sheriff's Office, the Veterans
Yes.
Court. I have a whole list of questions. I would love to be able to just come over and visit with you guys
would
as a
love
group,
to
because
do
I
that.
remember when we put all this together in the first place and everybody kept piling on, literally calling me wanting to be part of this stakeholder group. And I think that it's wonderful. I love the synergy. I love the dynamic response. And I would love to be able to visit more.
And you'll
about
be
it.
pleased to know that we're far along in discussions with the VA about bringing their services to the campus.
Good.
We're also far along with the Indian Health Service about becoming a regional health center for the 300,000 American Indians who live in Tennessee.
That's a big
Question,
deal.
Doctor, isn't the VA already there?
Yes,
Okay,
and the CBOP.
that's what I wanted to ask. Yes.
Larger role.
Go ahead. Yeah, I'm sorry.
I'm like Councilman Weiner. I'll probably have a host of questions that I'll have as I sift through this data. I just can't follow this up quickly. Very briefly, you mentioned the deal with the copay, and just to clarify the point you made, I'm assuming that what you're saying is when we invest the money, or I guess the insurance companies invested the money in the copay for those who were not getting that medicine, there's data to support the fact that once they started using that medicine and getting it, that it saved money on the other side.
There are numerous studies addressing disparities in outcomes for African Americans versus the Caucasian Americans. And one of those is, and whether you're black or white, if you're underinsured, you have a problem because you might have an insurance plan, but if the copay for a medicine is $1,000,
Right.
you're probably not going to use that medicine.
That's gonna-
And what the insurance company decided was it would save us a lot of money if we dropped the copay because the cost of caring for people who have bad outcomes would be lower for us. That's what they did.
Same theory behind free wellness care.
Exactly.
Yeah, I got you.
Exactly.
And only other question would be the page that you got the uncompensated care versus total revenue. It's broken out in percentages. I'd be interested to see the dollar amounts here and see how they compare.
We can do that.
Okay, good. And, all right, I'll shut up for now. Thank you, but I appreciate all this work. This is outstanding.
Okay, Councilmember Hurt, we got a couple minutes left.
So I don't have a question, but you know, I'm just as excited about this as you are because I was there.
Thank you.
To see all of this happen. And one thing I want to add to this is that the staff and the administrators that are trained at Meharry, it's a training ground for the big three because you have some of the best people at those organizations and institutions that got their training here. And I just go back to the Better Health Nashville where you're talking about you send to Vanderbilt and then they send back. I remember when Dr. Roderick Stevenson, a transplant surgeon, graduate of Meharry, a letter came from the governor of Pennsylvania because Dr. Stevenson saved his life. And we recruited him to Meharry, but we didn't really utilize him because we didn't have the need for that subspecialty, and he cost an enormous amount to have him there. And we lost him because it did not keep him, you know, fully equipped. So with this, you could use someone with that expertise at Vanderbilt so it can still be in the ecosystem in Nashville for us to have that quality of care. And I'm just so excited for this and just so happy that we've finally aligned it the way that it had been visioned from the beginning. So thank you.
I think the conversation itself was valuable for all the stakeholders to see things from the other person's perspective. So just the conversation to me was exciting to be a part of. So, but thank you, Madam Chair, for letting us
Thank you. We appreciate you being here. We appreciate you coming to deliver the message. You didn't have to, along with your vice presidents. We don't take it lightly whenever a president comes to give us a presentation. So we greatly appreciate it, and just know anything we can do to help you, we will. So thank you so much. All righty. This concludes our committee.